It's my honor at this time to introduce Dr. Michael LaCombe, whose brief biography is in your program. Believe it or not, the selection of a graduation speaker is one of the more challenging things I do as a dean. I often look for a physician because they know our work, its science, its rewards, its difficulties, and its trajectory in our lives. But I really like to invite authors because they can tell the stories that remind us of the emotional side of medicine. A year ago, I read a one-page essay written by Dr. LaCombe for the Harvard Alumni magazine and felt that he was the one I wanted for today's ceremony. I bought his book of short stories titled Bedside, and in it there's the following paragraph that was used to introduce a collection of stories around a single theme. And it went as follows. I once asked an old practitioner what he thought was the best job in the world. Mine, he said without hesitation. It's never easy, but it sure beats the hell out of whatever is in second place. It is more than a job. It is still a profession, whatever others wish to make it out to be. And what elevates our calling to that level is a history, a tradition, and a common bond that cannot be taken from us, though many from without and some of us from within wish to deny that legacy, attempting to transform our vocation into mere trade. It is there and always will be if we only remember. And if, in talking to one another, we help others to remember too. So, Michael, let's talk. Please help me welcome Dr. LaCombe.
Dean Dorsey, Board Chair Thomas, Administration, Professor Hingle and fellow faculty, graduates, family, and friends. Thank you for the honor of your invitation and for this very great privilege. A favorite story of mine tells of an alien who comes to Earth from another galaxy to warn us that with our weapons and endless wars, we are endangering our existence and the peace of our neighbors among the stars. The politicians won't listen to him, reasoning that perhaps those who engage in pure thinking might hear his message. He decides to approach a great scientist. The scientist's lecture hall is empty, but on the blackboard, the alien finds a complex mathematical formula spanning the entire front wall of the hall. It is a theorem of space travel. The alien smiles, shakes his head, begins erasing sections of the proof, and rewrites the solution, simplifying the formula considerably. He then sits in the back of the lecture room in the dark and waits. The scientist enters, flips on the lights, looks at the blackboard. His jaw drops. His eyes open wide, and he wheels around to find the alien sitting there. "You're the space traveler we've been hearing about? You wrote this?" asked the scientist. "Yes," says the alien. "I wrote those notes." "But," says the scientist, objecting, "what of the several variables you erased at this point? And what of the secondary equation I worked out over here?" The scientist checkmarks the equation and turns back to the alien. "Well," says the alien, "I find that this equation gets me from place to place." Now, I've been asked to stand here before you and tell you what it is that has gotten me from place to place. Why is it when so many of my contemporaries have retired 10 or more years ago, am I still working full time, resisting the blackmail of my wife, who says that if I retire, I can have a dog? So here is my equation for space travel. Here is what has gotten me from place to place. Your family comes first, not the patient, not your profession, not your career, and most certainly not material goods. The secret of a happy, productive physician is the happy, supportive family he or she enjoys. Call your mother once a week. Call your father once a month. No more than that, or he'll think you're up to something. It's as my son Casey told me once when I asked him how it was and why it was he called his mother and when he would call me. I call Mom, said Casey, when I need money. I call you when I need a lawyer. Call your significant other 3 times a day. 3 times a day, that's hard. Emails don't work, texting doesn't count, nor does voicemail. He needs to hear your voice 3 times a day, and then he'll be okay with your running around the hospital in pajamas. Choose consciously whether you wish to be a doctor or a businessman. Being a doctor is a calling and requires self-sacrifice, devotion, love, tenderness to your fellow man. Be a doctor without trying to live like one. Keep your overhead low, as the saying goes. Don't become trapped in a lifetime focused on material things. Belief in science, medical knowledge, honing clinical skills, facility with patients, a sensitivity to suffering, a deep love of non-medical literature, a few close friends. These are the important things. The beachfront property, the summer home, the Tony private school for your kids, the prestigious address, the academic titles, membership in exclusive clubs. These are just driftwood. Get to know your patient. You can't do it in 10 minutes. Observe. Are there any books on the bedside stand? Evidence of visitors having been in? Flowers? Cards? Drawings on the wall from the grandchildren? Give the patient a piece of yourself. That never hurts. You are not transgressing some imagined line designed to separate objectivity from caring. Grab a chair, sit down, and talk to him, eye to eye. Let the family stay in the room. Learn how to listen. You cannot understand another nor take a meaningful history by talking. Approach each patient with this thought in mind, that I will learn one single new thing from this person. Never ignore a sign or a symptom you can't explain. Trust the nurses. Listen to them. Let them help you with the patient. When in doubt, return to first principles. Take a history. Do a physical. Talk to the family. Ask the nurse. Between residency and military service, I spent 3 months in my hometown working in the emergency room. One dark night, though not on call, the phone awakened me. Dr. LaCombe, the nurse, said, "I know you're not on call, but we have this woman in shock. We can't get her attending to come in. We're losing her. Can you help us?" "Sure," I mumbled. "I'll be there in 10 minutes. "It's the OB floor," the nurse added. "The obstetrics floor. We're on the OB floor." The patient was very young, in her late 20s, with postpartum hemorrhaging. "Get some O-negative blood, 4 units," I said. "Now what do I do?" "Would you like to give some Pitocin?" asked the nurse. "Well, yes, of course, Pitocin." "How much?" she asked. "The usual." This one was an easy save. All I had to do was get out of bed and go in, and then listen to the nurses. When I went out to talk to the husband, I found an old high school friend, someone I had once worked beside in the paper mill summers during college. You've become physicians now and doctors, so you have the privilege of caring for others and of teaching others for no other reason, not for some imagined life as a doctor, not for show nor ostentation, nor social privilege and position, nor the acquisition of material things. Millions on this earth would give everything they have to trade places with you right now. for the immense opportunity to do the good thing, which they now find themselves powerless to do. Don't squander this opportunity. This caring for the patient, back it up with pure science. Stay up on things. Don't become some specious quack. Believe in intuition. Trust your gut feeling and go with it. Go back and listen to the heart again, in the left lateral decubitus, just to be sure. But do this having learned how to listen to the heart, how to probe carefully, how to catch the festination in the step, how to watch and notice, how to use your science. You will find in this that your patient comes to trust you, to lean on you, and learns to walk alone again. In 400 years, the radiologists will have it all down for us. With their scanning, they will show us just how central empathy is to the healing. And that becoming someone's personal physician is therapy itself. As scientists, you'll want proof that this formula of mine for space travel will work for you. After all, you want to avoid getting lost out there in the Oort cloud on your way over to Alpha Centauri. Very well. Here's my proof. Some 45 years ago, when I began residency in internal medicine, we had a mandatory 6-week rotation on inpatient psychiatry. I was assigned one patient to follow during the block. Her name was Nancy, a 17-year-old schizophrenic girl on the locked ward, who, responding to voices she heard, repeatedly cut herself, slashing her wrists and forearms, despite the best efforts of nursing to deprive her of any means of doing so. I'd see her twice a day, sit and talk with her, tell her about my young son and how he loved to have me take him fishing, ask her about her interests, her hopes, mostly consuming a 2-hour visit with a very one-sided conversation. I remember feeling at times that maybe we were getting somewhere, that she was improving, only to find her the next morning in a tangle of sheets on the bed, covered in blood. When the rotation ended and I left the psych ward for my remaining years of training, I would sometimes stop by to see Nancy, who was still there, still on the locked ward, still withdrawn, and occasionally still talking back to that voice in the far corner of the room. Later, during my fellowship, she presented me with a pair of red mittens she had knitted for my son, handing them to me with her head down, avoiding eye contact, perhaps a little embarrassed by what she assumed was a meager gift. The years passed, filled with the occasions all of us experience, the excitement of medicine and of the successes of treating disease, the increasing frustrations with bureaucracy, and in the twilight of a career, the recurring thoughts of whether you had really made a difference in life, had ever reached those seemingly increasingly disengaged students, had mattered to anyone. 6 months ago, on my way to meet my students for rounds, I stopped to pick up my hospital mail. In the pile of paper, I found a greeting card. I opened it. On the front of the card was a pencil drawing of a little boy holding up a fish. Inside was a note. It was from Nancy. Dear Dr. LaCombe, she began, many years ago when you were doing a rotation on the psych ward, I was one of your patients. With much kindness and patience, you worked with me and befriended me. It is long overdue that I should thank you and tell you how wonderful my life has turned out. I am a nurse in a busy family practice. I work with a doctor much as I imagine you to be now. I have an amazing husband of 31 years and 3 wonderful kids. None crazy. There were bumps along life's path, but only bumps. Many, many thanks to you for being a kind-hearted one on my path. I will never forget. I saw this card a long time ago and saved it, thought of you fishing with your son. I hope life has been good to you and yours. You deserve to be encouraged for being you when a crazy, cutting teenager needed a friend. God bless, Nancy. So now I need to close with a quote. My wife said that on reading this, that was too sad a note, so be lofty, lift them up. Here is a quote then for you from 1,300 years ago. It's from the Quran. No blame, therefore, is there upon the blind, nor any blame upon the lame, nor any blame upon the sick. And as for the insane, speak kindly to them, and feed and clothe them. Thank you.